To kick us off, I will go ahead and read aloud the guiding principles for the Health Innovation Community Partnership. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. Oops. And with that, I am delighted to welcome to the podium our colleagues from LA General to walk us through some of the fabulous updates of what's going on here. Jorge, Brad, and Nancy, join us.
Good morning. First off, welcome to LA General. We are going to share a few updates on some of the things that are happening. And to start us off, does this thing work? Yeah. Yeah. So we are so excited to announce that our medical center has attained a grade, a safety grade. And this is from the Leapfrog organization. And they're a national organization that rates all hospitals across our nation. And we've been working really, really hard on improving patient outcomes and safety measures. And we are so happy because this is the second A in a row that we've attained, which is a big deal. I'll ask Dr. Spellberg to talk a little bit about sort of the work behind the letter A. Yeah.
Thank you. So this is now the achievement of the second A means we've sustained this for a year now, because this comes out twice per year. I've been here 10 years. We had never been above a B. And frankly, a B was hard to get for us as well. To get to this A required a complete transformation of the culture of the organization, where safety came first. So the kinds of things the score reflects is we pretty much eliminated a hospital-acquired infection called C. diff, which is a super infection that happens to patients who receive antibiotics if the antibiotics are not used wisely. We've pretty much eliminated that from our hospital and have one of the top C. diff rates in the United States, frankly. Bloodstream infections acquired in the hospital, much lower than they used to be. Urinary tract infections acquired in the hospital, much lower than they used to be. Pressure ulcers acquired in the hospital, much lower than they used to be. Fall rates have improved. Every single type of patient safety event that you can imagine, we put teams together to implement changes to our procedures and trained our staff on how to avoid these harm events. And that's how we got to an A, and that's how we've sustained it. We're not going to rest on our laurels. It's really hard to keep the A, but we really are every month having meetings focusing on what are we going to do to get better still. We're not even satisfied just with the A. So we're going to do everything in our power to keep going, to keep improving all this stuff. Do you want to add anything, Nancy?
No, I think it's a true testament to the work that we do together as a team. So it's not nursing, it's not physicians, it's us working together with all the people in the hospital. It's the housekeepers that keep the rooms cleaned and make sure that, we're cleaning appropriately per protocol. But I really want to talk about how it's truly the work of how the team comes together and puts the patient first.
Thank you. Let's see. So the county every year has their their productivity and quality awards ceremony. And this is countywide. This includes all county departments. And so we were very, very pleased to be recognized for some of our programs here during this award ceremony. And we want to share some details about those programs. I think it's, let's see, the Bronze Eagle.
So I want to share this plaque. Out of 98 county departments that presented productivity and quality awards, with a lot of detail on how we saved the county money, how we improved efficiencies, and how we improved care. Our residency program on how we onboard new graduates got the Bronze Eagle Award, which is actually third place. So we're very proud of the work that our team has done together. As I said just a minute ago, this is truly a team effort. This is not just nursing doing this residency program that we put together. This is physical therapy coming and helping people learn about getting patients out of the bed. Many of the students that were getting out of school were students during the pandemic. So they didn't get the best clinical time because of the pandemic. So we are going back and doing skills labs during the orientation to make sure that they understand the importance of reducing falls, the importance of reducing hospital-acquired pressure injuries by getting the patient up, by turning the patients. So this was truly a team award. In addition, we were able to save about $12 million in registry because we've hired 487 new graduates and we have a 93% retention rate. Prior to the residency, it was about a 35 to 40%. But the new grads are coming, they're staying, they like what they see, they like caring for these patients. And we're able to decrease costs because we're bringing the contingency agency we had to bring in because we hadn't filled all of our positions. In addition, we worked with HR. It took 4 to 6 months to onboard a new graduate. And we weren't getting as many new grads as we could. And they've changed their process. So it takes 2 to 4 weeks. So from time of offer until the time they show up in the door is about 3 weeks. So we're very excited to be onboarding quicker. We're very excited to have some exciting new graduates and to really work together as a team to improve the care for our patients.
I think the most exciting part is they're staying. They're staying because it's a lot of investment in training. And in the past, we would hire folks and they'd stay for a year and then they'd leave. But the nice thing is they are staying. Another award, Safer at Home.
I think we may have talked about Safer at Home in the past at HICP. This was a program that was invented or created during COVID to allow us to care for COVID patients at home on oxygen. So literally people would come in to the hospital with COVID pneumonia requiring oxygen, and we had created a safe way to get them actually home on oxygen instead of sitting in the hospital. And that actually helped us during COVID avoid having to triage patients for life and death. We put 4,000 patients with COVID pneumonia at home. And if we hadn't been able to do that, we would have run out of beds. So as the pandemic waned and the virus became endemic, Mr. Orozco said to us one day, why don't we try to learn from this? Heaven forbid we should try to learn from something, right? If we can do that for COVID, how come we can't do that for many other diseases that we've historically required treating in the hospital? And so we did. So skin infections, urinary infections, pneumonias, heart failure, alcohol withdrawal. We have a variety of diseases now that we used to say you have to be in the hospital for a number of days. And now we send you home and you get a pre-programmed smartphone that directly connects you to nurses who are live to answer questions or concerns that may have. We have remote vital sign monitoring. The technology is there. We can actually check your vital signs remotely every day. And you get a daily check-in. If you need to come in for an evaluation, we arrange transportation for you to come back to the hospital to our urgent care. And so this program, the results of this program are now going to be published in a very prestigious medical journal in 8 more days, I think. And it is going to be, I think it's going to create a new model of care that other hospitals across the United States are going to try to adopt. We've proven it to be safe. It's saved enormous numbers of hospital days, enormous amount of money. And frankly, the patients love it. Would you rather be in the comfort of your own home, eating your home cooked meals? Or would you rather be upstairs in the hospital with blood draws every night? You can't get any sleep because your vital signs are being checked. Not a fun thing to be in the hospital. So this is a huge win, and we're very proud of this program.
Thank you so much. We also want to share an update on our Wilson High School mobile clinic. And so we have Dr. Breck Nichols here to give us that update.
So yeah, we've been collaborating with the community for many years to bring this to the community, and we had a needs assessment by the students at Wilson High School. One of the major things the students wanted was more access to healthcare. The high school clinic was allowing us to do that. We have started off with sports physicals initially and have been able to really make an impact on the number of students that miss school. Typically, if a student needs a sports physical, they miss the entire day of school. Their parents miss an entire day of work. And then there's a bunch of students that can't do that, so they just don't play sports. So so far, we've seen around 200 patients, almost exactly. And that means we've prevented 200 missed school days. We've prevented 200 missed work days for the parents. And hopefully Wilson High School will be winning a few more games this year because we have a whole bunch more athletes that'll be able to play for them. And that's a huge effort towards wellness. We also address other issues when we can, and that's also helpful because teenagers don't go to the doctor till they have to, and then they still don't go. So it's something that's been very impactful. The feedback so far has been very positive. We try to get an assessment from the patients, their experience in the clinic and what it meant to them overall. And they've been giving us extremely positive feedback so far for the experience in the clinic. They really appreciate that we're out in the community, that we're meeting the community where they are. I can't think of, I mean, that's pretty much the natural habitat of the adolescent is the high school. So we're out there, and it's been really, really helpful. And I think both providers and the students and the parents have really appreciated the experience and the help. We are working towards expanding, but that's a work in progress. But so far that we have a great initial start.
Thank you, Dr. Nichols. Any questions for the group?
Good morning, Jorge. Good work. I don't have a question. I just want to emphasize how important the positive impact on staff is for us, the community, and how much we rely on that. And I understand the work that it takes to do that, and the intention and the attention that you have been giving to this effort. And I know that you have done this systematically since day one. And now if we can only get you to have in the power to hire and maybe shorten that length of time for our community members who want to work here,
Right.
And who
Right.
could work here and who could have training here to do so. So thanks.
No, thank you for your comments. I think these kinds of initiatives really do elevate morale. Our mission is to provide world-class care, not just okay care, world-class care to all. And these are real examples of kind of how that's playing out in a real world. So we're very, very proud of that.
Yes, very exciting. Do we have additional questions for our fabulous panel from Los Angeles General? No questions? My goodness. And it's such exciting news. I can't believe it. And congratulations on the great work at Wilson High School. I know we were for the Health Innovation Community Partnership, we had a town hall at Wilson High School. And I remember very distinctly the youth there saying exactly that they wanted healthcare, they wanted mental health care services. And it's so exciting to see the mobile unit now going to our local high school. That's phenomenal. Let's see if we have any questions in the chat or any raised hands. mostly just incredible comments and praise for all that you've accomplished. So with that, we will move on to our next presenters. I'm very excited to welcome to the podium today our colleagues from the Department of Public Health from the PLACE program. So I'll let Jean and her team introduce themselves, but we're very excited to have you with us today.
Good morning, everyone. I just want to start by saying congratulations to our colleagues at the Medical Center. That's awesome. It's really exciting to hear that. Yeah, really, really big deal. And you know, we're going to talk about changing systems as well. So it's wonderful to see that you all are focused on that very important work at hospitals, changing systems for the better. We're trying to do that on the streets. So, but it all, you know, we're actually hoping to prevent, you know, injuries and fatalities from coming to your hospital. So good morning. My name is Jean Armbruster, and I direct the PLACE program at Los Angeles County Public Health, one of many county departments, along with the medical center. And wait a minute, where's our? Oh, there we go. PLACE stands for Policies for Livable Active Communities and Environments. And the program focuses on improving the quality of the built environment. So things like planting trees and building parks and eliminating traffic fatalities by installing sidewalks and bike lanes and things like that. One of our primary goals is to reduce traffic collisions and fatalities, making it safer and more comfortable for people to get around without a car. And this is really important for creating a more equitable, a more sustainable, and a healthier Los Angeles County. Everyone walks their roles. Everyone does that to get around their community, right? And that's really a fundamental human right, to be able to get around your community without getting killed or injured by a car. Unfortunately, our neighborhoods don't always reflect that. They don't always make that easy. And sometimes our neighborhoods, our streets can even impede what's otherwise natural to walk or roll to work, to school, to the bus stop, or wherever you need to go. So my team and I are here today to tell you about the work that public health is doing, along with our colleagues at Public Works, here in East Los Angeles, to enhance traffic safety through planning, infrastructure, and programs. First, some background on our data-driven approach to preventing traffic deaths and severe injuries. In response to growing traffic fatalities, both locally and nationally, a few years ago, back in 2017, the LA County Board of Supervisors called on Public Works and Public Health to develop what's called a Vision Zero action plan to address this public health crisis. The Vision Zero approach to traffic safety focuses on improving systems, much like we're doing at the hospital. Improving systems, practices, policies, engineering designs, et cetera, that will lessen the severity of collisions so that fewer people are injured or killed. The board adopted the Vision Zero action plan in 2020. And it includes more than 60 strategies, solutions that include things like engineering designs, new engineering solutions on our streets, education, enforcement, and evaluation. The county's Vision Zero goal, like the goal of Vision Zero action plans everywhere, is to eliminate traffic-related fatalities on our streets. When developing our Vision Zero action plan, we used collision data, where traffic collisions are happening, to whom and why, to figure out which roads in our unincorporated communities have the most severe collisions so we could focus our efforts there. We called these roads collision concentration corridors, or CCCs. And our analysis showed that 4% of county maintained roads account for 50% of all the fatal and severe injury collisions. I want to repeat that. It's really important. If we focus on just 4% of our roads, which is just 125 miles, we can take action to address half of our worst collisions. This is very important finding for us. The action plan, our Vision Zero action plan, maps these collision concentration corridors. And here you see the CCCs in East Los Angeles. These streets are some of the widest and the fastest streets in the community, from Olympic and Whittier to Cesar Chavez and Cesar Terrace Drive. Of those, Whittier Boulevard between Indiana Street and Record Avenue is on the list of our top 20 CCCs countywide. This slide shows an example of the kind of analysis we do once we know where to look. We can see who's involved, the circumstances of each collision, and the outcomes. For example, here you see data between 2019 and 2023, just for that stretch of Whittier Boulevard. And in that period, on that stretch of road, there were 38 traffic collisions, with 11 involving people walking on Whittier. 7 people were hit at an intersection, 3 were hit mid-block, and 1 person was hit on the shoulder. This kind of analysis helps us to make very specific recommendations as to what safety features or roadway enhancements can help reduce these collisions, and what kind of programming might help increase awareness and safety for people that are using these streets. This is a map of the proposed safety enhancements from the East Los Angeles Community Pedestrian Plan. So now I'm going to turn it over to Justin Robertson, who's going to tell you more about the development of this plan.
Thank you, Jean. Good morning, everybody. My name is Justin Robertson. I'm Senior Planner at the PLACE program. I lead the step-by-step community pedestrian planning efforts, which, as Jean mentioned, most recently included a plan looking specifically at East Los Angeles. This is Jean's last slide. I'm going to stay on here just for a minute to show you some of the tools in the toolbox, that once we identify where are the problems and what are the problems, what are some of the solutions? They include flashing beacons here. That's the mid-block signal. It's not a full signal with a red and a green and a yellow light. That's just for pedestrians. High visibility crosswalks there on the left-hand side. Those are those big fat zebra stripes that are a big improvement in visibility over the standard sort of parallel lines. Leading pedestrian interval gives you as the pedestrian a few seconds head start into the crosswalk before drivers get the green. So you're going to have a lot fewer right turn situations where you're crossing as a pedestrian and the car turns right into you. You're already maybe halfway through and very visible. So these are some of the solutions. Let's talk about how we get to this point. So in her introduction, Jean talked about why public health is interested in transportation and mobility, which is something that's usually left to the Department of Public Works. And here is an illustration of exactly what drives this work. Between 2019 and 2023, over 500 men, women, and children of all ages were severely injured or killed while walking in our unincorporated communities. The fatalities are shown here in red, and the severe injuries are in green. Regionally and nationally, this public health crisis continues to worsen. So in addition to injury prevention, we know that safe and welcoming streets can greatly expand opportunities for people to lead active lifestyles, reduce health inequities, and improve health outcomes. Walkable neighborhoods also support access to opportunity, as well as county goals around climate change, sustainability, and even shade and extreme heat, right? A walkable street is a pleasant street. What makes for a pleasant street? A place you want to be. Shade trees are often part of that. They beautify, but they also provide that service to us. Pedestrian scale lights, furniture like a bench at the bus stop so you can have a seat. These are essential to it. They're not just aesthetic improvements. They make that a place that encourages physical activity and economic activity. So since 2019, the County Board of Supervisors has adopted 8 of our community-level pedestrian plans, including one for East Los Angeles in March of 2024. And we have another 6 in progress. And these efforts involve our residents, the people who know their streets best, in identifying local challenges and opportunities for walking. These folks tell us things that we can't learn from looking at this collision data that I showed you. Stuff that I'm never going to know if I don't leave my desk and ask. They'll tell us things about near misses. They'll tell us about streets that they love to walk on or streets that they avoid and why. In East LA, these conversations were facilitated by a community-based organization called Public Matters, who over the last 3 years, you might have seen at events like Dia de los Muertos, the City Terrace Art Walk, parks after dark across the community, and many more. Engineers and planners like me combine that key local knowledge with where and why these collisions are happening, and we develop project lists for county public works implementation. And now we're going to dig in briefly into what these plans actually look like. So each plan includes the background information helpful so that we understand the context of this work, including the demographics, health outcomes in each community, land uses, access to parks, and other existing conditions. The plans provide maps, lists, and cost estimates for the proposed safety projects, all vetted by Public Works. And on the upper right here is an example of what the project lists look like. I cut out just a little piece from the East LA plan, showing you exactly what's proposed for First Street and Mednick. So you can see there, I don't know if you can tell on the screen there, the proposal is at 3 of the corners, install curb extensions where you have the curb doing this, and then as you approach the intersection, it bulbs out a little bit, it bumps out to reduce the crossing distance. And that's especially helpful for mobility challenged folks, older folks, to get across the street more safely. But it also helps slow traffic and generally improve conditions for everyone. And also at all legs, we're suggesting upgrading the traffic signals to accommodate that pedestrian head start that I mentioned. And it's accompanied by a map here. So there's First and Mednick and all the things in the neighborhood that are proposed, not just this, it's a piece of a much larger map. The plans also propose education and encouragement programs like safe routes to school, walking clubs, and more. And you can check out the East LA PED plan on our website. It's there on the screen, step-by-step, lacounty.com and paso a paso, lacounty.com, where you can read it in Spanish. And so the county has this big policy document that guides all development countywide. And I'm so proud to say that these plans are the first chapters in that giant countywide policy document to be in both English and Spanish, cover to cover, and the appendices in 2 languages, and we're really proud of that. So we're also working to increase language access as well as access to our streets. So now my colleague Ferdy is here to tell you more about the programs we're leading in East LA to help folks walk and bike safely.
Good morning, everyone. My name is Ferdy Simmons-Barrientos, and I am the program coordinator for the Bike and Pedestrian Program Education Program that's funded through the California Office of Traffic Safety. In partnership with People for Mobility Justice, also referred to as PMJ, we work to bring bicycle and pedestrian safety resources to East LA. We do this by engaging in interactive presentations that teach essential skills and on how to stay safe while walking and biking. Our program overall aims to reduce the number of serious injuries and fatalities among pedestrian and cyclists by empowering our communities with knowledge, resources, and safer environments. So just a little bit of data, as previously mentioned. When looking at data from 2019 to 2023, in unincorporated LA County, there have been a total of over 2,700 collisions involving pedestrians and cyclists, and this highlights the challenges faced in vulnerable communities. And when looking specifically at East LA, we saw that 475 of these crashes occurred throughout East LA. And as seen in the map here, we see that some of the collisions occurred in as Jean mentioned, along Whittier Boulevard, Cesar Chavez, and Atlantic Boulevard. And when we look specifically more into detail, 83 of these crashes were considered fatal or severe. In a recent study that our partners PMJ did, they did a bicycle helmet count in which they saw that approximately 79% of the bicyclists observed in East LA were not wearing a helmet. So this kind of highlights the importance of this safety education and continuing the work we're doing in East LA. When looking at data in the schools, we see that national and local statistics show that students, especially those who walk and bike to school, are at a higher risk for accidents. This is why I believe that early education can play a key role in reducing this risk. So on this slide, we present some data on traffic accidents that have occurred within a half-mile radius of schools. The first one being Garfield. In a half-mile radius, we saw that there were a total of 86 accidents involving pedestrians and cyclists. And from those 86 accidents, we saw that 2 were fatal and 10 were severe. While looking at an elementary school, Rana Avenue Elementary School, there were 52 accidents, which is a little bit less, but it's still a significant number since there were a total of 3 fatal accidents and 9 severe. So these statistics just highlight the urgent need to continue to do education specifically around schools and our youth. So just talking a little bit about what our program does itself. Our program does presentations on best practices while riding, rules on the road, and knowing your rights as a cyclist. This year, we're expanding our target audience to include school-aged youth. So we're looking to partner with local schools, after-school programs, and youth-based organization to host these classes and do these presentations for their students. We also have an additional focus on seniors, and through this, we do presentations on existing and upcoming pedestrian infrastructure and how it's meant to benefit them. Another thing that we're adding to this year's program is our skills workshops. This year, we're doing interactive skills, hands-on skills workshops like Fix a Flat, bicycle maintenance clinics, and first aid sessions to promote practical skills within the community and so that they are also safe while riding. We also host community bike rides and community walks. And last year, PMJ did a bike ride where they highlighted local food businesses in the East LA area while promoting the safety of all on the streets. This year, PMJ will also be organizing their very first bike rodeo in East LA. Additionally, just to talk about what PMJ has done, PMJ has done collaborative work within local community partners, including LA County parks, such as Salazar Park and City Terrace Park, to provide bicycle and pedestrian safety education courses and distribute safety equipment. They've also engaged with Edgemont Center and the East LA Certified Farmers Market, in which they've distributed helmets and shared information on the Vision Zero project. And most recently, they started to work with Las Dalias, an affordable housing program to offer residents interactive and pedestrian safety presentations and courses. Through a complementary program, as I mentioned, our Safe Routes for Seniors project is also working closely with LA Metro to provide the tap cards for our seniors at reduced fares. So we bring LA Metro to our events and they help them sign up in person, provide them with instant temporary reduced tap cards so they don't have to go through the process of sending out the mail and the application, waiting a long time. So it provides it to them instantly. And just in the last year, when looking at how many safety equipments we provided, PMJ was able to distribute over 286 bike helmets and over 159 bike light sets to our community members. So this year, as I mentioned, we are trying to expand to include school-aged youth. And we're looking to partner with local schools, after-school programs, and youth-based organizations to host our classes and workshop for their students. So if you are interested and would like us to come out and present, please feel free to reach out to us. You can email me, my email is up above, or you can scan the QR code and that will provide you a link with just to send me your contact information and I will be able to reach out to you. Thank you very much, and we look forward to partnering with you all.
Thank you so much for the wonderful presentation and all of the interesting data. Do we have any questions?
So you slightly mentioned Vision Zero, and so I'm wondering whether Vision Zero is part of this program and kind of like a other track similar to this. I understand that yours is public health focused, and they were, accident prevention focused. But my understanding is, as much as they wanted to prevent these type of accidents, Vision Zero failed or is failing. And I also understand that's true in San Francisco. So I'm wondering how this is different. Are you working in alliance with them? How does this inform? And then also you mentioned that you're working in unincorporated areas. And since it is a county program, I'm wondering if this program can be shared with incorporated cities.
Okay. So we co-lead with County Public Works, and the relationship between LA County Vision Zero, the program, and some of the other work we're talking about is that the analysis that goes into figuring out which are those worst streets that we ought to be focused on, that just tells us where to focus. And then there's another level of like, okay, now what do we do? Let's dig into those specific locations and figure out what's going wrong and what kind of solutions can be put into place. And most of the time, there's at least some engineering solutions that haven't been done at a lot of those intersections, right? The engineers are going to look at that and say, what's happening here? A lot of left turn collisions. Well, maybe we're missing a left turn signal here, or folks are taking that right too fast. Maybe a curb extension here is going to slow those turns, or take it from a shape like this to a shape more like this. So you have to negotiate that turn more slowly. And then there's the education, the enforcement, and the evaluation that Jean mentioned. Those are all sort of components of Vision Zero, which acknowledge essentially that collisions will happen. So the idea behind Vision Zero is not to eliminate collisions, because we know that's not possible. We're human beings. Some of us are operating cars. Some of us are operating other things or walking. Collisions will happen. How do we lessen the severity when those happen? What can we do in the environment, with the built environment? And what can we do within individuals to address this from all kinds of different angles? And depending on the community, frankly, this requires investment, resources, human resources, building things, which is never inexpensive, particularly in our region. Some things cost much more than others. And so to say that Vision Zero sort of as a framework has failed, I don't know is correct, because it depends on the circumstance and what did you do in service of Vision Zero to get to your outcomes, and what could you have done differently? It's not that, Vision Zero can't fail, it can only be failed. I don't think that's fair either. But there are different ways, depending on where you are, to address the problems that are unique to that place. So what happens in the city of Los Angeles and how they have organized themselves versus our unincorporated communities versus San Francisco or New York or any other community that is working on Vision Zero projects, it's going to be different. Circumstances are different, resources are different, political will is different in each of these places.
Thanks for that question. I think it's a really good one, and it's a fair one. I think we have to think about the approach, as Justin was saying. Has the approach failed? It's a systems approach, right? But it requires us to really focus on doing it, on making the changes, on actually implementing new types of systems. And I think that there's, we've done some of that, but we haven't done enough of that. So I think the approach is still valid, very valid. And I think we actually see that really effectively in places like Europe, where they've done a lot of this kind of thing. So I certainly haven't given up on the approach. I think it's an important approach, a really the right approach. But I think we need to do more of it, and do it much more systematically and much more, intentionally, and with more funding. So I wanted to answer your second question as well. What about cities, right? So right now we're lucky in that the federal government a few years ago passed the bipartisan infrastructure law and made available some new grant funding to improve streets. And we got a grant award in collaboration with Metro to actually reach out to local cities to support their efforts to improve traffic safety. And so we're going to be doing that coming up. We haven't started doing it yet because the grant, we haven't sort of got the contract executed yet, but it's coming soon. And that grant is going to focus on gateway cities. That's sort of those smaller cities in the gateway cities area, but it could be other places as well. So yeah, it's just I think our effort there, what we're going to be doing is doing some of this analysis for local cities that we talked about here, looking at their collision concentration corridors, helping them identify those, and then helping them sort of look at what grant opportunities might be out there to apply for funding to actually develop a Vision Zero action plan or implement infrastructure improvements on their collision concentration corridors. So it's a great question, because for public health, we're the public health department for all of the cities, as well as the unincorporated communities for all of LA County. We're all 10 million people. So we work there, and we care about that as well. So thanks for that question. I think there might've been one in the back as well. Oh.
Good morning, everyone. I just had a comment. I'm sorry, what was your name?
My name's Jean.
The person that, oh no,
Oh.
I know you're, I know you, Jean. Your name, please? Ari, nice to meet you. My name is Kalaya, and I'm actually from People for Mobility Justice, the organization that they were speaking of. We're really thankful to partner with the Department of Public Health. I'm the lead organizer, and our organization, we function at the intersection of equity in urban planning, policy, and community organizing. So as a community organizer, we really go into the community because the folks, the residents, are experts of their own environment, right? So part of this project has been a collaboration with DPH. And as a cyclist myself, speaking personally, I cycled for years, but didn't receive formal education through a bike safety class. And now in my role, we're really thankful to offer that to the community in terms of proper helmet fitting, riding on the correct side of the road. And so, as mentioned, these collisions are going to happen, but what we can do as an organization and in these collaborations with these unincorporated areas is really go in there where the education is so needed, where we already see unsafe infrastructure. The streets are needing a lot of care. They're being neglected. We don't have enough bike lanes. And when we see intersections of the rails and bus stops and the lack of infrastructure for cyclists and pedestrians, that's where we see a lot of collisions and unfortunately deaths. And so through the educational side, facilitation of educational workshops, how to be on the road properly and safely, and through these bike rides where we're able to celebrate food vendors in East LA, for example, we're really able to hit where the community needs the resources the most. So hopefully that answers your question. And we're really looking forward to going deeper in East LA and other unincorporated areas.
And I actually wanted to add to that while we're waiting for the next speaker. Thank you so much for coming and for your remarks, Kalyan. One of the things that's such an important part of Vision Zero is creating a culture of safety, right? Actually changing the way we think about our streets, deciding it's important to be safer on our streets. What have we seen in the last few years? It's like people are driving much more crazily than they were before the pandemic, right? And that's contributing to the problem. So really, Kalyan's work and Ferdy's work is really about sort of being out there and talking to people about the importance of having safer streets and promoting that kind of consideration of our fellow users of the road, really thinking about them and trying to make sure that they stay safe. They're going to get home to their family that night, right? And that's the most important thing. It's more important than you getting to your destination 1 minute faster, right? So so just thanks so much to all of our community partners who are helping promote that culture of safety.
And we did have a comment in the chat about a location at Williamson and Hubbard, 1 block from the Eastmont Center, where there are frequent accidents and people getting hit by cars. So just making that comment from someone in our Zoom meeting space. Perfect, thank you. Do we have any additional questions for our group here today? Okay. Well, I found it really interesting and kind of sad, unfortunately. I mean, it's some tough information that you guys work with every day, but like you say, it is about building a community culture of safety and really prioritizing pedestrian and bike health and wellness over accessibility by cars. We love our cars in Los Angeles, but that being said, there's ways that we can improve the situation and really keep our streets safer for all. Okay, well, thank you so much for joining us today. We really appreciate the presentation and appreciate your time with us. And with that, we're gonna move on. I am gonna right now we have scheduled Dr. Carla Gonzalez to join us and talk about breast cancer, health and safety. But unfortunately, I don't have her slides quite ready to go. So I'm going to actually accelerate the agenda and we're going to move forward into our break time. So this is a little break time for you to get up and stretch your legs. Please help yourself to the refreshments in the back of the room. And we want this to be a bit of a networking break. So please take a moment and, speak with someone in the audience, introduce yourself to them, and we'll be back in about 5 minutes. Thank you. We're going to go ahead and get started again. As always, I'm so excited to welcome to the podium Dr. Carla Gonzalez, who serves not only as the Director of Urgent Care here at LA General, she also is, of course, our invaluable Medical Director for the Wellness Center. And she's here to give us our community health update for the month. And she's going to share some information with us about breast cancer. Thank you for joining us, Carla.
Thank you so much, Heather. I am so excited to be here with you to talk about this topic in particular, because sometimes there's bad news and not great news, but this one actually has some really good news. And I think that we're on a really nice track with this. And I think there's just a couple more things that we need to do together as a community. So I'm energized by being here, and thank you. Thank you for having me. So today I'm going to talk about this topic. So I am also an urgent care provider here at LA General. And as you know, being a safety net hospital, we see people that have not touched the medical system, sometimes not ever, or maybe touching it for the first time, or maybe just very sporadic medical care. So we do see a lot of things that are coming in pretty late. And it always reminds me that we have screenings for a reason. We have screenings because early detection can definitely save lives. So this is what we're here to do. We're here to kind of catch things before they even happen, before they even, become a problem. And it's really in our power to be able to do this and share this information. So thank you all for being here, and thank you all for sharing with your friends and family as well. Okay, so today I'm going to talk about some of the risk factors for breast cancer. I'm going to talk a little bit about data because I love to include data and tell you guys why, right? It's not just fair for me to tell you to do something and not give you the information. We're going to talk a little bit about screenings and then what could be some of the next steps that you can take. Okay, so this is kind of like the not so great news, right? This is the part that we don't really change. So what are the risk factors for breast cancer that maybe are a little bit beyond our control, or a lot beyond our control? So sex assigned at birth is one of the risk factors. Age. I would love to control my age. I always say that I want to start not counting my birthdays anymore, but age greater than 50. Having started your period before age 12. So this is one that sometimes people don't think about. And we know, for example, that young kids are actually getting their period a lot sooner now. So we don't completely understand that phenomenon, but it's something that's going to have to be on our radar. And it's something that we're going to have to do more research on and address a little bit more or a lot more in the future. Having menopause after age 55. Again, this is probably all related to hormonal changes. We don't exactly know the mechanism, but this is kind of where we're thinking we're going. Having dense breasts. So I'm going to talk to you guys a little bit about mammograms, so I'll come back to that. There are some genetic mutations, and we might not know if we're carrying them or not. So there are some things that alert us to genetic mutations, a family history, particularly a family history of having a mother or a sister or a grandmother. Those three are the main ones: mother, sisters, grandparents, grandmother, that had cancer at a relatively early age, where they didn't really meet a lot of those risk factors, that were unmodifiable risk factors, but they still got breast cancer. So this kind of sets off a light for us. And then we can check to see if you carry these genes. Now we do a lot for the people that carry these genes, and there's a lot we can do to make sure that they never get breast cancer. Having had, of course, a personal history of breast cancer, there's always an opportunity for that cancer to recur. We talked a little bit about family history of not only breast, but also ovarian cancer. Having had previous radiation for a different type of cancer. So if you had thyroid cancer and maybe you had radiation to this area. I had an uncle who had radiation to his neck for a lymphoma. He ended up having a lot of issues from the radiation afterward. So having had radiation, And then there's a medication that we don't use anymore. It has a very long name. I'm not even going to try to say it because it's just so long. But we only used it between 1940 and 1971. We still see some people that may have been affected by this today. So we always ask about this history, but just know that we don't use this medication anymore. Okay. So possible risk factors. I talked about the ones that are definitely risk factors. I'm going to talk about some that are possible risk factors. And then I'm including one that we're not too sure about, but I'm including it because I think it's important for so many other reasons. So smoking. This is one that we just, if we can, every time that I have an opportunity to talk to somebody who smokes, even if it's a little bit, even if it's like social smoking, we always talk to people. Tobacco is probably one of the worst things that we can do for ourselves, for our community. We have a great efforts with the Wellness Center and some of our grants to be able to work in the communities to try to reduce some of this. And I think they spoke with us last month. So very excited that we're in all these efforts, but smoking. And then also know that with smoking, it is hard to quit. So we do have medications available for this that can help. Different types of exposures. So we always ask about what were you exposed to? Where were you at when you were growing up? Environmental issues, right? These are always really, really important. What medications did you take? Hormone changes. This is like hormone changes due to shift work. So this is really something we, again, don't think about. But how many people know somebody that works at night and maybe then they change their schedule for a few days and they work during the day? That's awful for so many reasons. And thank goodness to the people who do it because we know that it's so necessary. But those changes can be really detrimental, not only because you're losing sleep, but we think that they might also affect your health in bigger ways. And then drinking alcohol. So, drinking socially, we always actually ask about how much alcohol people are drinking because we know that, the data out there is going to switch from one day. One day you can drink a glass of wine and it's, good for your heart. And then the next day the data comes out and you're like, well, actually, it's not that bad. Any kind of alcohol is really bad. So everything again in moderation. So this is a really good thing to speak with your doctor about because we actually count. There's actually a number that we know, right? So we say like 5 drinks for women, and then drinks are not like, oh, here's my drink. It's like, smaller drinks, right? So we kind of ask more questions. So I always say this is that as physicians, we're really, really nosy, and we're not asking just because we're nosy. We're asking for a reason because we're going to do something with that information. And that is really important. And it's always very special when the patient can share these things with us because we know sometimes it's very private. Some people don't want to talk about alcohol. Some people don't want to talk about some of the practices that they have. But also sometimes people are like, hey, doctora, le voy a ser honesta. I'm going to be so honest with you. And when they do, I always say thank you because that's really important information. I'm going to do something with that information. And then I'm going to give you information so that you can make some decisions. Okay. I said I was going to give you guys data. And this is like where things are going in the right direction. So people have rallied around breast cancer. I think this is one of the cancers that probably gets so much attention. I think because we know so many people, everybody has somebody that's been affected by breast cancer. So I want to talk about the numbers from 1999 to 2020 and the death rates. And as you can see, pretty much for everybody, non-Hispanic white, non-Hispanic Black, Hispanic, non-Hispanic American Indian, and non-Hispanic Asian or Pacific Islander, we see that the numbers have actually decreased for everybody. We think that this is definitely due to having more awareness around it, more people rallying around it, more people speaking on it, and then us getting better with our detection, with our early detection. And we'll talk about early detection in just a minute. But I do want to talk about like the average decrease per year. So I'm going to go into the next slide. And this is why I always ask why, and I want people to know what is happening here. Yes, so we have less deaths from breast cancer, but we do still see that like everything there are disparities. So I'm going to highlight this one for you. I'm going to highlight our Black counterparts. Where we see that, despite the fact that we have lower incidence, and maybe this is because there's less detection, but we also see that the mortality rate is higher. So does that make sense that even though we have lower rates than say our white counterparts, that the death rate is higher? And we see this is kind of becoming like I talked about COVID in the past. I talked about influenza. And these are some of the things that we're seeing, that when we do get some of these diseases, that our outcomes are much worse. So this is always the why. Why is this happening and how can we change it? So this is our opportunity for change. So I said I had good information, positive information, but I also, want to talk about what can we do different. And what we can do different is we can affect some of the modifiable risk factors. Okay. So some of these include, okay, so what are the recommendations? So I get this question a lot, and I'll be the first. We have to be very honest with data and what we have. In a few years ago, there were people that said you start at age 50 and you start at age 40. And then you go to the doctor and one doctor tells you to do it like this, and another doctor tells you to do it like this. So part of that is that not that they were both wrong, but that they were both sort of correct. Okay. And now as data is coming in, we are more on the same page. So the US Preventive Task Force, they put out a lot of good information about what our screening should look like. And it's based on a lot of data. So now we know that women ages 40 to 75% are 74 years of age and are at average risk. So they don't have any of those high risk, those red flags. They don't have a family history. They don't, do any of the, alcohol, and they don't do, they're not over age 50. So those people can actually have a mammogram every 2 years. Okay. And that has changed. I just show of hands. Does anybody recall a time when we did pap smears every year? Right. And that was crazy for somebody to tell you we don't have to do it every year. We can do it now every, 5 years, do it every 2 years, every 3 years. So this is something that we are modifying, all the time as we get more information. So mammograms are really important. Mammograms are used to detect early breast changes and also possible cancers in women without any symptoms. That's the key to screenings, is that there's no symptoms. Not that you have breast pain, not that you found a lump, not those people. Those people we're going to figure out and we're going to do something about them. It's the people who have nothing, right? And this is a problem, is that people say, I feel fine. I don't feel sick. There's nothing wrong with me. I don't have a family history. So why should I get screened? Screenings are exactly for that person who they don't feel anything. There's no problems going on. So the benefits of mammography even outweigh, this is a question that I get a lot, but there's radiation. And then the other one that I get a lot of is it's painful. Okay. I understand that. That is actually true. It can be it could be a very uncomfortable exam, but it can save lives. And the amount of radiation is actually minimal, to the point that we know that the benefits outweigh the risks. Okay, so really important. This is like the newest frontier. We're actually on the cusp of some very new medications that if you have some high risk factors, you can actually talk to your physician, you can talk to your provider, and you can even read up about it. Some of the medications that you can have to help you, kind of modify some of the things going on in the body biologically that may be risk factors for having higher incidence of breast cancer. So if we already know, for example, that maybe your family has the BRCA gene, somebody in your family was identified as having BRCA, there are things that we can do. We can send you to genetic testing. So one of my very good friends from public health, when I did my master's in public health, she was very aware of her BRCA gene, called the BRCA gene for short, BRCA. She was very aware of it. She knew she actually had to have a double mastectomy she was 22 when she did it, because it was something that she really wanted to prevent later in life. So she's doing well. It's not something that she's ever going to have to worry about, but she didn't know that risk very soon, and she was able to do something about it. So again, tests that are out there, you can talk to your doctor about, and medications. And then making a plan for those modifiable risk factors, right? What are we going to do to keep ourselves safe? What can we do? What's in our hands? Exercise, eating well, all of those things, right? That we can really have in our hands and we can change. And these are the parts that I want you all to focus on. I want you to tell your family about. I also obviously want you to tell your family and friends about mammograms and the importance of mammograms. And then we talked about medications. This is a part that I talk about quite frequently. And I know that for some people it might be scary, but participating in research, it's hard to get like, our blood drawn and saying, sure, take my information. But I do want to share that there are a lot of great organizations that are out there that will take your information and do some really amazing work with it. They're not there to like do big brother type stuff, right? They're not there to monitor or watch you. They're really there to kind of gather this information and figure out what can we do? What parts of the DNA structure, what risk factors can we really modify? And right now, as we know, we had all of us come and talk to us in the past. We do not participate. We as a group, as Latinos in this community, do not participate so much in research, but we need you. We need you. I myself have been part of multiple research projects. I did one where I found out that actually I'm at higher risk for diabetes, not just because of my ancestry, not just because of my family history, but because they gave me some, it was a sugar drink, and they were able to see the way that my body responds to sugar and how high my levels got. And they said, you need to be extra careful. And sure, and this was maybe about 5 years ago. Sure enough, a couple years later, I have one of those monitors that monitors your glucose continuously, and it's actually high. My sugar's actually high. So I did something about that. So again, research. Whenever you can, if you want information about research, please participate. We need you. We need your information, and it helps our entire community. So I think that's it for me. I'm going to go ahead and open it up to questions.
Do we have any questions for Dr. Carla?
Hi, Dr. Carla. Thank you for that presentation. You mentioned that there are trustworthy organizations that will collect data in a responsible manner for people of color considering doing research. Do you have any organizations in mind that do that?
Yes, so All of Us is one that is a great organization. There's also a project, Wisdom. There's a Wisdom trial. That one I think is organized by UCLA. I actually was part of Wisdom, and I got a lot of great information. Now, I sent off and of course, I want to say that I am not endorsing any of these. This is stuff that I want you guys to look into to see if it's the right option for you. I wanted to be part of research. I wanted to do my part. And so I participated in Wisdom study, and Wisdom study came back and, gave me some information based on what they know. For example, I found out that I thankfully do not have the BRCA genes in my family, because sometimes these could come up without family history, but I found out that I don't. And I was able to make a decision for myself that I actually didn't need a mammogram every year, that I could do my mammogram every 2 years. Mm-hmm. Any other questions? Okay. Thank you, Heather. Thank you, everybody.
Okay. Thank you so much, Carla. Appreciate you as always. Okay, so now we're moving on to the final segment of our presentation today. We've got three speakers that are going to share with us information about some of the projects coming up on the campus. So we're going to have Alicia Ramos join us from the Department of Public Works to talk about the Restorative Care Village 4 and 5.
All right, thank you, Heather, and thank you for having me again. It's a great opportunity to come in front of the HICP on a periodic basis and give you an update on what we're doing here on your campus. So again, my name is Alicia Ramos. I'm with LA County Public Works, and we manage a lot of the vertical construction projects on campus. Do I have a clicker? There we go. Okay, so we're going to take you through some of our restorative care village projects, which are happening on the northwest side of the campus at the intersection of Zonal and Mission. Oops. Let's go back one. Okay, so here we are at the corner. Whoops, hold on. Can you cue that up? Thank you. Perfect. Okay, so here we are at the corner of Zonal and Mission. And this is the area that formerly had the Women's and Children's Hospital, which we decommissioned and we went ahead and we took it down. But what we're putting in its place is actually two projects. To the bottom right that you see in a blue outline is what we call Restorative Care Village Phase 4, which is a combined building with Department of Public Health and Mental Health. And that will be approximately 33,000 square foot building that will house a mental health urgent care center and a residential withdrawal management facility under public health. To the left, you'll see in the red border, that is our subacute or psychiatric subacute building, which will be a 3-story, about 90,000 square feet, and it will house 96 beds for subacute mental health services. I want to point out what is in the yellow border, which is right at the corner of Zonal and Mission, and that is it's a city-owned strip of land, which we are working right now to have conversations with the city as well as Department of Water and Power, because they have a lot of high voltage lines that run under this strip of land. But that strip of land is right at the corner of the medical center. And so we realize developing what we technically have on our plate will leave this strip of land sort of empty. And we think that it needs to be addressed so that it's part of this campus and it looks like something that belongs here, and we can hopefully put some resource to it. Okay, these are just some rendered images of what we anticipate the buildings will look like when they're complete. The buildings right now are in a very preliminary state, but this is phase 4. This is the combined building for public health and mental health. This is the larger facility, phase 5, and that is the Department of Mental Health, psychiatric subacute. And as you can see, it is right there along Mission. And you can see that strip of land with the city at the very left bottom. Right now, we're envisioning that it will at least be landscaped, but we're also looking at opportunities to see what more we can do to make it a programmable space. Okay, some interior images. Again, these are rendered because the buildings are obviously not at the stage yet. This is what it looks like right now. So for somebody like me, this is exciting. You see steel, you see dirt, things are happening, even though it's nowhere near a building, but this is starting to take shape. And so if you are around the North West Campus, this is likely what you're going to see right now. There's still a lot of grading work going on. Keep in mind, we have 2 projects. So phase 4 is what you're actually looking at right now. That building, since it's considerably smaller, is going to be done ahead of phase 5. So phase 4, we expect will be done in 2025. Phase 5 will be done at the end of 2026. A couple more images of what we have going on. You can see in the background, phase 1, RCD phase 1, which is the completed building with that sort of red tone to it. Okay. All right, so just to go over some of the things I mentioned, completion of phase 4 will be the end of 2025. Keep in mind, after we finish the buildings, we still go through a licensing process, and that can take 6 to 8 months. So we expect that services in phase 4 will be available in fall of 2026. And the same goes for the phase 5 work. We will end construction at end of 2026, but we go through the licensing process. Services are expected to be available winter 2027. Okay, if I could ask you to bring up the PDF. Thank you. One thing I want to go through with, I'm mentioning phase 4, phase 5, and I'm sure a lot of you folks are going, where's phase 1, where's phase 2, where's phase 3, right? So what we've done with our partners at Mental Health, Public Health, we are preparing, we don't have it here today, but just to give you a heads up, we are preparing what we're calling sort of a fact sheet, little package about the Restorative Care Village projects. And we will have that available to you shortly. We're having it, first of all, we've done it up in English, but we're going to have that translated into Spanish as well. We'll provide that to HICP and have that up on the website, and we'll bring hard copies here for the next meeting. But what it does is it first gives a background. What is each phase about, so that you folks have some context? Phase 1 is already done. Phase 2 is actually happening in the inpatient tower of the hospital. Phase 3 is a permanent supportive housing, which we'll have partners here to talk about that just after me. Phase 4 and 5 are largely dedicated to the mental health, behavioral health programs. Can you scroll to the next page? There you go. We've also put together what we think are FAQs, frequently asked questions. When I get up here to talk about the buildings, I talk about it from a construction standpoint. Obviously, when the buildings are done, the services are another service provider between mental health, public health, and also their contracted service providers. The questions will probably surround, what are you doing in that building? Who are the patients there? What are the treatment facilities and services that are available? How might you get in touch with either of these facilities if you feel someone in your family, somebody you know could benefit from those services? So we'll have that information here. If you could scroll forward again. There you go. So we've got a host of questions here that we've anticipated. We're always up to hear more questions. So as we continue to come to the HICP meetings, when we hear more questions come up, we may be expanding on this so that it can be a resource that continues to live as we hear more concerns or questions that come from the community. One more forward. But one more, I'm sorry. And then ultimately, we want to leave you with a map. This will be part of that fact sheet package we're putting together. But you can see in the middle is the campus. And this is just noting where are all these phases happening. As I just verbally went through it, I can tell you where they're located, but the visual is probably more helpful for an ongoing basis. So we'll have this available for the next meeting. Again, we'll have it at the HICP website, and we will have it translated into Spanish as well. All right. With that, I'm going to hand it over to our next partner here, and maybe we can collectively go through questions afterwards. Okay. Thank you so much.
Good morning. Am I the next partner? Just double checking.
Okay, yeah, Hi, Iris. Yes, if you'd like to start, we'll go ahead and take the slides down, and then we can pin you, Iris.
Okay, great. Thanks so much. Good morning, everybody. And so wonderful to be here. And thanks so much for queuing me up, Alicia. I am going to figure out the tech and share my screen here. And I'll be talking about one of the artworks at Restorative Care Village Phase 5 that Alicia just mentioned. This is the building that has the very long facade on Mission. And before I go into just some of the thoughts of the civic art process that we're at the very beginning of for that building, I just wanted to mention for those of you who don't know me, and then a little bit of a refresher for those that I've worked with before, that I was the project manager for the artworks in earlier phases. So for these murals that you know on Zonal Avenue and within the campus already. And we worked together with HICP, all of us collaborated to sort of figure out, number one, what kind of artworks would even be best for the campus. And what I heard from HICP was that murals and fountains would be the most desirable. And then fountains are something that are not permitted on a mental health campus. So we focused on murals. And so knowing this history and this legacy of this campus and thinking about the future growth, we really focused on making this a campus where there will be murals. So that becomes, we know this is something that the community appreciated because we heard feedback that was very kind. And so thinking about continuity and giving this sort of a campus identity and what would bring the most joy and have the most impact for the community, we thought about doing another mural. So on this building, and then also our goal is always to find art locations and provide artworks that have the most impact, that are in the greatest service of the community. So towards that, and as Alicia mentioned, this is the building called RCV5, and this is Mission, which we know is incredibly well traveled. And the artwork location that we're looking at is this, which in this preliminary rendering is rendered in brown, which actually signifies a metal panels, not unlike the metal panels in the previous phases. So this is what this looks like in plan. So here are the cars going by, and this little green line here is the extent of the mural. And we worked closely with the architects and with Public Works to find the best location for the artwork, and also technologies that would not interfere with the schedule of construction and that would be doable within our budget. So here is the mural, which an artist or artist team could decide, to make 3 murals. It could be 1 mural that's continuous. Artists will think of something amazing. And so that's what that looks like. And then here, I wanted to show this to show the size of this mural, because this is an almost 30-foot high mural. It is much larger than the murals that exist on the other buildings. So this will be incredibly impactful for anyone driving by. And also to mention that this particular building is almost like when we were talking about it, it's almost like a gateway to the restorative care village. So we were able to meet with the co-design committee yesterday, which really signified like the initial kickoff for this project. And as anyone knows who worked with me previously on this, we're very interested in having this artwork co-arise with HICP engagement. And the first engagement that I'd like to organize is a future meeting with HICP where we talk about the themes for the artwork, and where I collect like actual terminology and words from you that help the artists help define the themes. And then those words will be used in a call for artists, in bullet form, so that when artists are thinking about what kind of work they want to show, they already know what kind of things you're thinking about. So this meeting, we're hoping to have this meeting with you between now and the next HICP meeting, so that at the next HICP meeting, I can present some of these themes and have like a second round of feedback from you. And then the other thing I wanted to just point out is that when we are working with artists, we're very interested in their community engagement, and their community engagement can take many forms. It could be workshops, it could be that they're going on site and photographing and interviewing people. Like, this is part of their artistry and their craft, is to help determine what the community engagement is. And that at each point of let's say of artist selection or artist proposal selection, we will be including the HICP in helping to vote on how to move forward to the next steps. Another thing I wanted to point out is, because we're really dealing with multiple communities in this building, so we've identified this mural location as a primary location where there's sort of an interface between the campus and the outside neighborhood, and sort of a combining of the two through this mural, in my mind, since I'm very mural focused. But we're also understanding that there's a community inside the building that are the consumers and also the staff. And we're putting aside a certain amount of budget for some secondary artwork so that they also benefit from artwork. I think that is it. And I'm going to open up to questions unless, Alicia, did you want to add anything?
Yeah, we'll hold questions to the end. How about that, Iris? All right. So next up, we're going to welcome Alex to the stage. So we'll rejoin the PowerPoint that Babkin's running for us and hear about RCV3. So we're going to cover 3, 4, and 5 today.
Yeah, good morning, everyone. My name is Alex Stamus. I'm a senior development manager at Century Housing, and we are so excited to be one of the many phases of RCV. We're 3, so we're right there in the middle on the other side of Mission and Griffin, working to develop the permanent supportive housing component of RCV. It's okay. Anyway, phase 3 here is up in the top center of the screen. It's on the corner of Mission and Griffin, as I mentioned. This is the project we brought to you a number of times. This is 296 units of affordable housing. 150 of those units are permanent supportive housing for those experiencing homelessness. A subset of those are for no place like home households, which is a county designation for folks who have a mental illness. But the balance of those units, the other approximately 150, are for higher income folks who are still under the affordable housing threshold. So those units are generally at 60% AMI, providing for more standard community type housing. Both buildings, and there's two phases, have a variety of other community serving uses. Phase 1 is 146 units, and it has, in addition to the standard housing units, a pure respite facility. So that's a 6,000 square foot space that will work in conjunction with the other RCV phases to provide step-down care to the greater general hospital area. Phase 2, which is coming up, is a 150-unit building that, in addition to the housing, has a variety of more community-focused services, more specifically. So right on the corner there of Mission and Griffin, we will have the Workforce Development Center, which includes a large commercial kitchen. We have a retail space and the cafe space, which we've talked about with this group and the community many times before, that we're really excited about. When I last came to you, we had talked about the community engagement events that we've done over the last number of years in coordination with Supervisor Solis's office, which have been really successful. And now I come to you with another very exciting update. Just like Elisa said, she loves when it happens. This is for me too. I love when it happens, right? So for phase 1, which is the northern building, that's the building that's closer to the train tracks over there, we applied for this funding through the state of California called Affordable Housing and Sustainable Communities. They call it HICP funding, right? This funding is 2 parts. It has a housing piece and a transportation piece. So the housing funds the units that we've talked about. The transportation piece funds all of these other beautiful services, similar to what our other friends were talking about earlier. You know, these are bike lanes, street improvements, transit improvements, bus curb cuts, all of these things that make the community just more inviting and pedestrian friendly. And we applied for $35 million. And this program is remarkably competitive, oversubscribed 3-4 times to 1. And I'm very, very excited to relay that we actually won the funding. We were the 3rd highest project in the state. Yeah, thank you so much. And this was a true community effort. I mean, all of the beautiful work that we've done with all of you over the last 3 years was a huge part of the application. We talked to the supervisor's office almost daily, in addition to CD14 and the HICP, all helping tell the story of the wonderful things that you are all doing, right? And that we're all trying to do together. And so that's fantastic. So basically what that does is it's $25 million for the housing. And then it is another $9 million to help fund the Valley Boulevard Multimodal Transportation Improvement Project, that very long acronym that has, oh, here, my slides. Thank you. Okay. Oh, this doesn't work. Okay. Oh, I'm sorry. Yeah, sure. Sure. Nope. Is that better or should I just hold it? Thumbs up, thumbs down, thumbs up. Okay. All right. Thank you. So with the slides now, some of the same information. So phase one is the building on the north side, right? And you'll see that the building's about 6 stories. That is the building that has the parking. So there's 115 spaces of parking. That'll be for the building there. You'll see that little cutout is a very nice community garden that'll be for the residents. And also in that general area is the pure respite facility that I was talking about. Then you have phase two, which is this building in the front. If you could go maybe one slide back, actually, that's a better picture of phase two. So this is phase two. And then right there, you see how the building is raised on that corner. Right under that is where the workforce development space are, the cafe and the retail space are. So that is something that we hope will allow for, in addition to the transportation improvements at the intersection of Mission and Griffin, allow for this building to really mesh with the rest of RCV and the rest of the community. Because our goal is that you go there and buy things and are going to the cafe to buy the things that the people in the Workforce Development Center are making, you know, and being paid to make. So what you'll also see are these big public art opportunities, right? I love this. I just walked the other RCV phases after the last HICP and was just blown away by the artwork. We hope to do very similar things here. So you can see that we have, in aggregate, that's about 3 stories. So probably 30 feet or better, similar to what's going on at RCV 5. And then here's another public art opportunity. And this is phase 2. So we're really, really excited about the buildings. And if you go to the next slide, or maybe 2 more even, I'll give you some updates. This is a little bit more about the transportation project. This is that Valley Boulevard transportation project. So like I said, that ASIC funding gave $9 million so we can build more of this out, which is fantastic. So there's tons of things this includes, you know, bikeways and streets and traffic signal improvements and all the wonderful things that we were talking about. So phase 1 in terms of timing. So phase 1 is the project that just won ASIC. And what we did right after, in fact, it was like 4 days after, we applied for another huge sum of tax credit money. This is our last financing source that we need in order to start construction. So it amounts to about $53 million of tax exempt bonds through the state of California. So we've applied, and we won't know if we won until mid-December. December 11th, they tell us if we won, but they release the scores. And so based on some preliminary ranking we've done, we're hopeful that we'll win. So can't say for certain, but we have hope, right? If that happens, phase 1 starts construction in May of next year. It has about a 26-month construction timeline. It's a big building, some complicated details, but that building would be opening in 2027, you know, God willing, all things go right, you know. So we're very excited about that on phase 1. We're spending a lot of time and effort there. We've been doing a lot of the technical drawings on that building and are hoping to submit for LA County plan check by the end of the year. So we really are trying to move as fast as we can on phase 1 because we really want both buildings to open as soon as possible, right? On phase 2, we have secured, with huge thanks to the supervisor's office, $20 million of funding from LA County, specifically the LA County Development Authority, and are looking for our last piece of financing before we apply for that big state money we just applied for on phase 1. So we're on the hunt for more money. It's about there's money we need to find there. There's a state source with some financing available next year that we're hopeful for. That application would be in April, hoping to get that money later in the year, with hopefully phase 2 starting either at the end of next year at the earliest or the beginning or the middle of 2027. So we're really, really excited about the progress. We're very hopeful for this last financing award for phase 1. And we are even more excited to bring you this building, hopefully on short order. So thank you. And then, yeah, any questions about all the RCV projects? Yeah, sure. There in the back. Sure. Yeah. Mhm. Yeah. Yeah. So the county funding came in kind of 2 portions. So, oh yeah, I'm sorry. So the question was, in relative to the state funding that was hyper competitive, how competitive was the county funding? So the county funding was competitive. Part of that funding came through the initial RFP that was put out for the RCV phase 3 site, which was, so that helped speed the process along because we didn't have to win the RFP and then go out for funding. They were able to group the competitive processes. And then there was another slug of $10 million that makes the 20. And that was competitive also through the county. Yeah, thanks for your question. Any others? Oh.
Thank you, Alex. My question is around the terms again, so that the community can better understand what supportive housing means. So that first phase is parking and housing, and primarily who would be the resident of those units?
Yeah, no, thank you for that question. I think the terms are always, they get a little nebulous over time, right? So I appreciate the opportunity for definition. So phase 1, if you go to the slide where you can see both buildings, might be helpful. Yeah. Oh, if you don't have it, that's okay. But anyway, basically phase 1 has what they call a podium parking garage. You can think of it like a first concrete level. So that's where everybody parks. It's a covered, secure area where they can park. On top of that is where we build the housing. So that's the first story. And then on top of that, we build the housing. There's 146 units on phase 1. 75 of those are what Yolanda was mentioning, supportive housing. Basically what that means is folks who have experienced homelessness come into this housing, and that's the housing part. The supportive part is that we have trained case managers there who can help them with any problems they have, right? And this ranges from benefits counseling to mental health to physical health to behavioral health, all of the things they need to live happy, healthy, stable lives in the building. That's 75 of the 146. The balance of the units is just standard affordable housing. This is affordable housing that is less high touch, you'd say. This is something similar to another just standard affordable housing building that would be in the community. That said, we will still be providing services to those folks. Less services because we believe the need to be less, but it'll still be those same kind of things, right? Benefits counseling and referral counseling is an interesting one too, that we're excited to work with the community on. The way that would work is, I would go up to someone and say, I really need a doctor, right? And say, well, thankfully we know a lot of doctors, right? Here, let's connect you, right? Those are the kind of things that would be the services for those normal affordable units. And that's the two parts of the housing. That answer your question? Thanks. Hi, Guadalupe.
In terms of the populations, I believe one is for seniors, right? And one is for families.
Oh, yeah.
So I think it'll be good to share that. Yeah.
Yes, thank you. Yeah, I failed to mention that when I was, going freestyle off my slides. But yeah, phase 1 is undifferentiated. So it's anybody can live there, any age, individuals, families, anybody. Phase 2, though, will be just seniors. So part of that will be seniors who have experienced homelessness, and then normal or otherwise seniors who are in need of affordable housing. So we think it's a nice balance. That was different than the original proposal we came to the county with as part of the RFP, and that changed through the community engagement process. So we're very happy that it's more of what the community is all looking for. Anything else? One thing, if I can just add one more, the public art that I had mentioned, we will go through a community engagement process to solicit feedback, very similar to what's happening at the other RCV phases, and engage a muralist. That will happen probably once we're in construction, because it just makes more sense. I would hate to ask a bunch of questions to you all and then it not to show up for another 3 years, right? So we'll do it when it makes a little bit more sense, but also say is that's coming. So be on the lookout. We will still be at these meetings giving you updates with hopefully more good news to come. Thanks, everybody.
Well, thank you. Do we have any final questions related to the RCV? I do see a question in the back. Elijah, would you be so kind?
Just a transportation question. What would that look like? I know I saw that from Valley, it's starting, I guess, in downtown, going all the way to the 710. What does that look like? Or do we have a plan on how that is going to impact the community?
Yeah, so that Valley Boulevard project has 3 phases, right? That's only one of the, or 3 segments, I should say. That's only one of the segments. And the city has done a lot of outreach, and we've done outreach in our own engagement events about those also. But it's a pretty wide-reaching streets and bike project. They have a really good website, actually, if you Google the Valley Boulevard project. But just to give a little more definition, the segment that was up on the screen is from Union Station to, I think it goes all the way to Cal State. And it's all of those things that we mentioned. So it's street improvements, transportation improvements. This is new bus islands, places for the buses to turn out, new bus stops, new bus benches at the stops, transportation improvements, really a lot of the things that they had mentioned earlier. But the streets themselves stay the same, right? You might get a lane, a dedicated bus lane on one of the streets, but it's not like they're creating new streets or taking out streets or anything like that. It's just improving what's there more than anything. So, yeah, that answer your question? Yeah, sure.
This is Guadalupe with SD1. Just to add, I know that project was presented, I think a couple meetings ago, at the HICP, but we're hoping to bring back the consultants that are working on that project to just focus in on that and what does that entail. I know that that project is going to go out for more engagement because they're going to, there's different phases of plan developments for those improvements. So we do want to have them come back to HICP and present, and especially how it relates to our projects, right? I know the idea is to also make the area more walkable. And because we see more pedestrians, right? As you saw, there's going to be 296 units, right? And then we're going to have additional, through the the RCV 4 and 5, there's going to be more activity, more folks walking in that intersection. So we definitely want to pay a lot of attention to how that's treated. And so those are some of the things we'll definitely come back and have the group present more. But we're seeing a great opportunity, with all the different components already coming online. And so, again, with the help of all of you, it's all happened because of all the support, the engagement. So thank you all.
Thank you, Guadalupe. So any final comments or questions related to our exciting projects happening here on the campus? Well, if not, this is kind of exciting because we're actually going to end early, which I think this may be the first time ever. And I happen to know this is the 81st meeting of HICP, so that's pretty impressive. But anyway, thank you again to all of our presenters for joining us today. Thank you, our audience, for coming and joining us today to learn about what's going on in the communities surrounding the LA General Medical Center campus. It's really through these community conversations that we get a lot of great feedback and guidance and advice on where we're headed next. So this is a plug for our next HICP meeting, which will be back to our regularly scheduled first Friday. We will be meeting here in person and virtually on Friday, December 6th. And that meeting is going to be very exciting. We're going to have a presentation by Centennial Partners about what's going on at the General Hospital West Campus. But the majority of our time is actually going to be spent together reflecting on the accomplishments of HICP over the last few years and where we're headed in 2025. So we want to very much hear from you in terms of what are the topics of conversation and what presentations do you want to see in 2025. We look forward to that conversation in a couple of weeks' time. With that, have a very, very happy Thanksgiving holiday. The Wellness Center is going to be celebrating and supporting families in our community. And we also invite you to come join us on Friday, December 13th at our community posada. So those 2 events and many others are happening here on the campus over the holiday season. So please come join us, and we look forward to seeing you there. Thank you.